First Start Tutor Asia, and today's lesson will be on how to set up a continuous feed for a patient who has either NG tube or a PEG tube. And so if you are struggling with your skills on how to know, how do I prime the pump? How do I do a bolus? Then guess what? This video is for you. All right, so let's get started. I'm going to go ahead and perform hand hygiene. And we're going to go ahead and put on my gloves. So the only materials that you need for today is going to be a Kangaroo pump, and then you're going to need your Kangaroo set. All right, so with your Kangaroo set, it comes with 2 bags. So you have a bag that is your blue one, and then you have one that is your purple one. You guys, so if you are using a Kangaroo pump, you need this one, okay? All right, so let's get started. So first we want to do is we want to look in the orders to see what type of order does the patient has for their feed. Do they have a continuous feed or do they have a bolus feed? So right now our patient has a continuous feed, and then you want to look at what nutrition is ordered for the patients, because you want to make sure that you're giving the patient the correct nutrition. So the patient has a Premier protein shake order. Follow with me. All right, so we're going to give this to the patient. So the order will tell us how fast to run this at. So our order is going to tell us that we're going to administer 35 mLs per hour. And then the order then is going to give us how much to flush with, our water flush. So you guys, this is how I want you to remember it. I want you to think of this as the patient's steak and potatoes. Think about it. If you're eating steak and potatoes, don't you want water? Right, so this right here is going to be our patient's water. So what you're going to go ahead and do is you're going to just go to the faucet. It just depends on what your facility does, but normally we just use faucet water. And you're going to take some water and you're going to pull it in the blue. You guys, it is so important that you put it in the correct bag. So remember, water, blue. So once you got that done, you want to snap it right here. And then you want to hang it on our pole right there. All right, so next we have our purple, which is our feed. So we want to make sure that we shake this up, and then we want to make sure that we have the correct feed, okay? And we're just going to pour this in there. All right. And then we're going to hang that up there as well. So one of the things that comes with this is on the side. In your bag, it lets us know, okay, what is the nutrition formula that's in here, how fast it's going to run, and when did you hang this. So it is so important to fill out all this information and place it on here. So now let's go to the actual machine. So you're going to look on the side right here, and there's the door is already open, but you would just open the door, and then you would just separate this part right here, and then we're just going to line it up. So you're just going to line that part up, and then you see right here, you're going to just loop it around, and then you want to take it straight up, and you want to shut the door. All right, so right here, this is the tip that is going to be connected to the NG tube or the PEG, okay? All right, so when you go to your pump and you turn it on, press the power button and turn it on, it's going to give us a couple settings. So the first setting is going to be to prime it. Press prime pump. So you can do an auto prime, or you can actually hold to prime your flush or hold to prime your feed. So what we're going to do today is we're going to do them separately. So we're going to press hold to prime flush. So you want to take the cap off. It's the bag that the little set was in, just because it's already there. But if not, if you have a trash can nearby, that's fine. So we're going to prime the flush first. So priming our line just means getting all the air up out of there, right? So we're going to hold it, and you can start to hear it make noise. And then you want to follow the water. So you can see that the water is coming all the way down. It's coming. So you want to make sure we just get all the air out. And you want to make sure that when you are priming, you are not connected to the patient. So you see water's dripping out there, so we're good now. So now we're going to skip to prime the feed. All right. So then it's going to put all the feeding next, all the way to the tip. All right, we're going to keep going. And you can see it's coming up the line. All right, so now we have it primed all the way up to the tip. So remember, you guys, it is so important that before you hook it up, so let's say that the patient has an NG2, which they do in this case scenario, that placement has already been verified by chest x-ray. So now that we know that it's in the stomach, then hey, we're good to use it. Let's say if the patient had a PEG tube, we could then check gastric secretions. It is important that when your patient is receiving feeds that you make sure their head of the bed is at least at 30 degrees at all times. You would just go here, connect it here, and then that patient is good to go. All right, so let's go to our pump. So we're gonna click done, and we're gonna adjust our feed. So we're gonna set what we want to adjust our feed to. So our feed rate, the physician gave us an order for it to go at 25. So we're gonna set it to 25. And I will show you guys this in a few. And we will set it to 25, and we will press okay, enter. And then we would need to do our feed volume to be infused. So we would just put in how much ever that we put in this bag right here. So if this is 325 mLs, we will put 325 mLs. So we'll put that in there. We'll click our done, and then we will adjust our flush rate. So let's say the physician gave us an order to flush with 100 mLs, and the interval is going to be, let's say, every 4 hours. So we would set that on there. So every 4 hours, the patient will get 100 mLs of water. So once we have all that set, we're able to press, run, and then the patient will be able to get their food. So the medication, not the medication, so the feed will go all the way up the tube and down into the patient's stomach. So that's if your patient was ordered for a continuous feed.